Mine mapek ojiw mondo mi oriere kod limo kuonde thieth mar geng'o midekre mabiro e kindego kaachiel kod keto ngima nyathigi kama ber. Kano lose chenro ma idendo kaka maternity fund e osiptal ma Imara, laktar mar nyithindo Eric Musau omedo ni limo klinik e seche ma miyo yach konyo e yore mang'eny kaka geng'o tho mar nyithindo e kinde mag nyuol. Musau jiwo joma wuone mondo mi okonyre kanyakla gi mine mayach e kindego mag pek. Martin Gishovu manoko minode chenrono bende nosiro jipo makamano.
Today we are hosting pregnant mothers within the region. It's a maternity fund day, basically to impart knowledge in a fun way, to learn about pregnancy, what to do, the do's and don'ts, and also to learn how to take care of their newborn babies as they begin the journey. Some of them are embarking on their pregnancy journey for the first time, and such comes with a lot of uncertainties, a lot of myths, a lot of wrong information that has been shared out there.
Okay, one of the risks that your baby and you as well as the mother are predisposed to while you're pregnant, there's a risk for severe bleeding. You should give birth to a hospital so that we are able to monitor the bleeding and help to stop the bleeding. So that bleeding is a risk. Your baby is at risk for getting an infection when delivered in a place that is not clean or sterile. That's what we use the word. We use the word sterile. So the baby is at risk for infections. The baby is at risk for infections through the cord. When you now tie the cord with the wrong things, we usually use clamps, which are sterile. So I would very much encourage you to just go to the hospital and avoid any traditional methods